Hello, I'm Dr. Dennis McKenna. I'm joined today by John DePaula. Hello,
Hi, Dr.
John.
McKenna. Pleasure to be here.
Great. Chat with you in a second. Today is Wednesday, December 30th, bringing you the update from Albany Med. So, John, welcome. You go by many names. John, JD. You are Senior Vice President for Admin, Executive Associate Dean in the college. You serve many roles here for us, and you've been so involved in logistics with COVID, we thought it'd be helpful to have you here.
Absolutely,
So,
Dennis.
glad to have you here.
Yeah, great opportunity to serve on both fronts, both from a medical center standpoint and college standpoint.
So before we begin, I'm growing a beard.
Looks good.
Not really. So I figured in Fred's absence, I would have to fill in with the beard, and the consensus is it looks ridiculous.
I
so
disagree.
I'm going to have to shave it. But in case people are wondering, that's what's going on there. Probably by the new year, it'll be gone. So
sorry to hear that.
So let's jump into the numbers here. These are the COVID numbers. This is the first graph. This is the capital region in the 8 counties. We currently have 399 in the hospital with COVID. We had our regional call today. Those are the ones that Dr. Venditti and the other hospitals lead through. And same story everywhere, really. The numbers are up in all the hospitals in the capital region. Next graph here is the admissions and discharges here to the medical center. You can see, John, on average, between 10 and 15 admissions per day. The good news, if there is any, is that on the back end, we have about the same discharges per day, so it's plateauing, but still no flu activity here in the hospital.
Which is great.
And so the next and third graph is always the one we look at, which is the morning census here in the medical center. We currently are looking at 115 here in the hospital with COVID. John, of those 115, 15 of them are no longer considered to be infectious. Right. They test positive for COVID, but based on the criteria that the CDC publishes, they're no longer infectious. We're just waiting for them to be discharged back to a nursing home setting. We call them persistently positive. So really, we have 100 that we're actively treating. We currently have 8 on ventilators. This morning, I misspoke. I said 15. It's actually 8. If you look at that number compared to the 115 in the hospital, it's a lower percentage than in the beginning. And again, we think some of that is because of the advanced therapeutics we now have, convalescent plasma, remdesivir. So a lot of good things happening there. So everyone's working hard.
Good stuff, Dennis.
All right, so very good. So really, John, let's begin with you. In the beginning days of the pandemic, and then over the summer it dropped off, but then we've had the second wave. You've led our logistics team in incident command. You've been there with all the major decisions about how to prepare ourselves for patients. Can you talk a little bit about that?
Sure thing, Dennis. I mean, the thing that jumps out at me is the incredible teamwork from a variety of sources within the medical center that really all sort of came together, partnered together, and just started solving problems and supporting our clinicians in a variety of ways. And you know, some of the ones that immediately come to mind from a supply chain standpoint, those folks have been absolutely magnificent. They have kept the amount of PPE here in the medical center, you know, at a better than adequate level pretty much the entire period. And just a phenomenal job by all of our representatives in supply chain. Another group that comes to mind is clinical engineering.
Yes.
We have sort of transitioned units to care for COVID patients, and a lot of maneuvering of our clinical equipment, monitors, and so forth. So clinical engineering has really worked closely with clinical leadership to transition that clinical equipment to get them on the units that we're designating for COVID patients. Also, what comes to mind is IT. Our information services group here has done a remarkable job on a variety of fronts. The one that comes to mind to me is the iPads. They have sort of scoured the region, if you will, and got the amount of iPads that we need to have to give to patients who can't have family members come visit them. And we utilize the iPads to have COVID patients in their rooms communicate with family members, you know, during their stay here. And then lastly, I don't want to forget sort of support services. You know, really Bob Pasili's led a group of just jack of all trades, just helping us on a variety of fronts to keep the momentum going and caring for COVID patients.
So obviously, I'm sure we could probably spend another hour talking about all the different areas, but that's a perfect example of the type of work that logistics does within our incident command structure. And they will report up to you, and you are responsible really for making sure that all of those plans come through, which has been, I think, incredibly helpful for our patients and for our workforce.
Thank you, sir.
So then we've now transitioned over to giving the vaccine. And once again, you were put in charge from a logistics standpoint of putting together a team and figure out how it was we're going to vaccinate our workforce. So just to let our own workforce know where we're at right now, we're now at Tier 4 inside Albany Med. We're still what's considered 1A as far as vaccine distribution. Anybody who works in a hospital is considered 1A. We take our own workforce and we broke them down into different tiers. We're now at Tier 4. We've been vaccinating people down in the BE entrance really now for a couple weeks. Give us an update. I mean, it seems like it's going incredibly well.
Yeah, the BE entrance is the area that we utilize to vaccinate our own staff. And again, Dr. Pausé and some others have led sort of a coordinated effort of the staff that we are going to vaccinate to try to get it to staff most needy initially. And again, we're trying to get all staff, but as we get vaccines coming in, we do have to prioritize. And the process has gone very, very well, and it's really been kick-started and expedited today with a lot of our staff getting vaccinated today.
So for those who are watching tonight, we're going to have the vaccine area open up again from 5 p.m. to 9 p.m. And then tomorrow, New Year's Eve, we're going to be open from 7 a.m. to 11 a.m. So if you're watching this and you're now in Tier 4, 1, 2, 3, or 4, they can go down and get vaccinated, correct?
Absolutely.
And if I'm not mistaken, we've crested over 4,000 people have been vaccinated here.
Correct.
That's unbelievable.
Correct.
And we're soon approaching the people who were in the first group who got the Pfizer vaccine. They're about to get their second shot.
Yeah.
And that's going to be sometime next week.
Next week.
Which is incredible as well. So I know a tremendous number of efforts going on there, including all sorts of people stepping forward to help with the pharmacy process, the vaccination process. And you described what it was like down there. There's people who are very emotional about their ability to get the vaccine, which has been great.
Yeah, correct, Dennis. I mean, it is an emotional experience for some. I mean, we've had some people actually break into tears as they received the vaccine. Yeah, of happiness and tremendous relief and appreciation. So it's been an incredible experience.
So Albany Medical Center has been put in the enormous position, very proudly, of being the lead, the planning lead for the Capital Region vaccine plan. Every day we're on calls with all area hospitals, all 8 county health departments, all the federally qualified health centers, and our liaison from the state. And under the leadership of Ruth Leslie, who's planning this for us, we're rolling out that plan. That is due to the state tomorrow. We've set up a pod, a place of dispensing vaccine to people in the community at one of our facilities down on Broadway. And you've helped set that up as well. So we've brought in those people from 1A, which includes EMS workers and others who work on the front line in some of the facilities, and that's going incredibly well as well.
Incredibly well, Dennis. Again, we just started providing services last Tuesday, if you will. I'm sorry, last Wednesday. We started the planning on Tuesday, started seeing sort of patients on Wednesday, and the response has been really overwhelming by medics, firefighters in the region. We've provided vaccines for almost 2,000 of our firefighters and paramedics in the region. It's gone really, really well. And again, I think working through the COVID patient scenarios in the spring and in the fall really primed us to be ready to kind of hit the ground running with the vaccination process now, which is really, really exciting. And looking forward to continuing over the next couple of weeks to really continue to ramp up and get the volumes of people that have been vaccinated to be very, very high.
So a couple final points on that. Our communications department is put out a communications plan for the Capital Region. You can go to Capital Region Vax, that's VAX.org, and that will be where we'll put information about where different places to get the vaccine are available in the Capital Region, where people are on the various tier plans, when they're eligible to get it. We'll share county health department plans. It'll be a great resource for people to go to in the future. That's capitalregionvax.org. In addition, we're going to be really working with our community volunteers to help work in these pods, not just at ours, but the health department pods. The other hospitals will be setting up pods to vaccinate. John, we have to vaccinate almost 1 million people, and we have to give every person 2 shots. Right. So we have a lot of work to do. We've already begun to reach out to community businesses and others who will help us in that area. And I think next week we're going to be able to announce a couple really exciting areas where they're going to step forward and help us with these vaccination efforts.
I agree, Dennis. I mean, the response throughout the community of these organizations has been tremendous, and they're anxious to help and support us in any way, which is great.
All right, well, very good. Well, thanks for that update, and
Sure
thanks
thing.
for everything you do to help us, for sure.
My pleasure.
So that'll do it. We're going to end. Fred is remote today. He'll be back next week. This will be our last video of the week, but we'll be back next week, Tuesday and Thursday. Again, Tuesday and Thursday. And that's it. This is our last video of the year.
Good
So,
stuff, Dr. McKenna.
We'll see you next
Thanks
year.
for having me.
Thank you very much. I think I'll be shaved next time. Again, that's the consensus opinion, so it's going to follow that. To everybody who's out there working in the medical center over the holiday, we appreciate everything you do, and we certainly appreciate the fact that you'll be working on the holiday. We'll be back again next year. Once again, we ask that you please take care of yourself, take care of each other, and we'll see you in 2021.